Welcome to the Certification Board of Infection Control's webinar entitled, How to Prepare for the CIC Exam. It Takes a Plan. Three of us will be presenting today, myself, Barbara Russell, 2012 CIC President, and two current board members, Joann Andrews and Lita Henman. The content of this webinar is designed to give basic information and answer frequently asked questions we receive. Since this is not a live presentation, we will not be able to take questions at the end. Should you have any, please send them to info@civic.org and we will respond. So let's get started. Well, let's start with the objectives. The objectives of the webinar are 1, understand the recent changes to CIC and the CIC exam. 2, become familiar with the exam content domain areas. And 3, be able to state the difference between recall questions, application questions, and analysis questions. Well, the objects of certification are to provide a standardized measurement of current essential knowledge needed for persons practicing infection prevention and control, to encourage individual growth and study, thereby promoting professionalism among professionals in infection prevention and control, and formally recognize professionals in infection prevention and control who fulfill the requirements for certification and recertification. Before we get into the information indicated in the objectives above, I would like to take a minute or two to review some general information regarding certification. It's important to know that the examinations are aligned with the practice standards for infection control and healthcare epidemiology, that the only standardized measurement of essential knowledge, skills, and abilities expected of infection prevention and control professionals, and most importantly, all examination questions are the copyrighted property of Certification Board of Infection Control. The examinations themselves are comprehensive. They're job-related, objective tests that include 150 multiple choice questions, of which 15 questions are under evaluation and therefore not included in scoring. They will not be counted against you if you got them wrong. The questions are developed from a practice analysis of infection prevention and control professionals in the U.S., Canada, and other countries. And in fact, the next practice analysis is scheduled to begin in early 2014. And I hope if you receive any information or are asked to do a survey pertaining to this, that you will take the time to complete it for us. And lastly, certification examination is recognized by APIC and CIC Canada as the standard for certification in infection control. Well, let's talk a little bit about eligibility for initial certification. 1, you must have primary responsibility for the infection prevention and control program as per your employing organization. You must meet practice requirements for current clinical practice of infection prevention and control. You must meet the educational requirements. The definition of infection control practice. It's the clinical practice of infection control occurs in a variety of settings and includes both 1, analysis and interpretation of collected infection prevention and control data, and 2, the investigation and surveillance of suspected outbreaks of infection, and includes at least 3 of the following activities. 1, planning, implementation, and evaluation of infection prevention and control measures. 2, education of individuals about infection risk prevention and control. 3, development and revision of infection control policies and procedures. 4, management of infection prevention and control activities. And 5, provision of consultation on infection risk assessment, prevention, and control strategies. The eligibility for education is that you hold a current license or registration as a medical technologist, physician, or registered nurse, or you have a minimum of a baccalaureate degree. You may go to the civic.org website and you'll see at the top of the page a rotating picture, and when the one comes up and says, are you eligible to take the CIC exam, I encourage you to go to number 6, because it will go through the same questions we just reviewed and will help you determine if you are eligible. Well, let's get to how to begin. Joann, turning it over to you.
Thank you, Barbara. Now we're going to talk about beginning your preparations. sometimes with a big project, I don't even know what those first steps should be. Have you ever felt that way? Well, we'll share some information to get you started. The APIC Study Guide is a wonderful resource, and it will help you become familiar with many of the topics. It's not enough to pass, though. You must broaden your studies to the other resources that are mentioned in the candidate handbook. You might find a local study group or start one of your own. If there aren't any others in your area, how about using different types of media to form a group? There's conference calling, Google+, or even Skype, and you could form a virtual study group. Your local chapter, whether you live in the United States or in Canada, is an excellent source of help when studying. But don't forget to attend regularly to get all of the benefits. And you might even be able to suggest topics for speakers that would help you with your studying. Well, we all have experts in our own facilities, and they are wonderful resources to turn to. I found for myself I was weak in the micro area of study, and our micro friends took me right under their wing. I spent a day in the micro lab, and I promise you it helped me studying for more than a week would have done on my own. So think of all those experts that you work with: sterilization, endoscopy, ID physicians, environmental services, and I know that you have others that you can think of. And then the APIC text is essential when studying. And while you can't read or remember all of that, you can use it instead to identify areas where you require further study. The time and effort that you put into studying is one of the keys to success, people have found. So whether you set aside time every week or every night, it's a very important practice to actually schedule this regular study time on your calendar. Otherwise, it might end up being like so many other things that you think you're always going to get around to, but never do. And so as a suggestion, maybe you can have a set period after work every day or on your lunch period, and then an even longer study session on the weekends. Next, everyone has areas in which they need to spend more time. And so it's best to identify these areas as you study and concentrate more heavily on those problem areas. In fact, if you have the opportunity to attend a conference or workshop, be sure to select areas which you wish to strengthen. Next, while I'd like to tell you otherwise, there's just no tip or practice guide that can substitute for spending time learning the basics. You must spend time reading in the APIC text and in the other suggested resources that are listed in the candidate handbook. And then, as you get closer to your date and feel a little more confident, be sure and purchase the Civic Practice Exam, and this will allow you to get a feel for the way that questions are structured and for the ability to complete the exam in the time allowed. Many, many successful candidates have said this was essential to being comfortable when they walked into the exam. Begin to think about scheduling the exam. It's important to choose a time that works for you. First, consider the time of year when you can really focus on studying. For us in South Florida, that usually means that tourist season is already so busy in our hospitals that summer might be much better. And you also might want to avoid those stressful holidays. So also think about the time of day when you perform better. You know, some people are definitely morning people, and others choose afternoon. So I can't stress this one enough. Although the 2-year wait period has been lifted, make sure that you wait long enough that you're comfortable and you're ready for the test. And next, life in general has a way of throwing us curves sometimes, so make sure that you schedule far enough out to leave a cushion for family or other emergencies. Lastly, schedule your specific date. It might be that you choose a Monday in order to take advantage of that last-minute weekend studying, or really any date that you can assure that you don't have other things on your mind. From there, you just simply work backwards to select a study, to select a date and to schedule in your study time. Now, as far as statistics goes, everyone likes statistics, right? Well, maybe, maybe not, but here's some interesting ones for you. There's a 3-hour time limit for the exam, and the average successful candidate takes about 2.5 hours to complete the test. Candidates who are not successful, on average, take about 10 minutes longer. And then next, successful passers have been found, though, in groups that use slightly more time and in groups that use less time. So our best advice is to rely on your own test-taking strategies. You know, if you've been successful in preparation for other exams, that this strategy will help you, definitely help you here. And be sure to use all the time that you need. But statistically speaking, using more time does not always equate to a better score. We understand that it's not always easy to afford the exam, and employers don't always pay for it, but we have some ideas here as well. Just like setting time aside, you can also think of regularly putting a few dollars aside, and then when you're ready, you'll be surprised how much you've saved. So whether you save daily, weekly, or monthly, it doesn't really matter, just do it. So what could you give up on a regular basis and instead put that money in your civic savings? Even spare change adds up very quickly this way. Lastly, I want to say to ask your employer. Some of them will pay for your certification, others might support a portion of the expense, and still others will reimburse you after you pass. And the point is, it never hurts to ask. Just think, you could save a lot by eliminating your specialty coffee while you're preparing for the exam. Or could you give up a new pair of shoes? Well, I understand that would be very hard for me as well, but it is a way to save for something that you'll find very valuable. Some of your colleagues were thoughtful and have shared some wonderful advice lately on IP Talk. While we can't quote them all, Judy Moy from Maryland did give her permission to use some of her thoughts. Judy said, obtaining your certification isn't limited to those of us that work in hospitals, and that is certainly true. The CIC practice analysis helps us to tailor the exam to more than just hospital IPs. Judy also said, I followed the content outline and I read the corresponding chapters in the APIC text. And she said, I took the civic practice exam and wrote notes and flashcards too. And this is a good point. Your own flashcards written in your own hand can be very helpful as you study, and it will help you retain that critical information that you need. Now, Jo will tell us a little bit more about the exam.
Thanks, Joanne. What great tips on how to prepare and study for the exam. In my part of the presentation, I will try to give some more details on exactly what to expect on the test, as well as the procedure when you go to the testing facility. We're hoping that the more information you have, the more comfortable you'll be, and the lower your anxiety level will be about this important step in your career. On this table, it shows you that there are 6 different domains in the testing content area. So for example, one of the domains is identification of infectious disease processes. There are 18 test questions on that, and those 18 questions are broken down into 5 recall questions, 10 application questions, and 3 analysis questions. And you can see if you add all these different items up, it equals 135 questions, which is the number of test questions that you will be scored on. So you might be asking yourself, exactly what are these different kinds of questions? So let's go over the different cognitive levels. Recall is the first one we talked about, and it's exactly as it sounds, that only memory alone is what's required. You just have to remember a specific fact or piece of information. Application is a little bit higher cog level, and it requires interpretation or manipulation of concepts or data. And examples of that would be calculation of a rate, recognition of patterns, and finding relationship between concepts. And the final cognitive level of questions on the exam is analysis or evaluation. And it actually requires pulling together different pieces of information and then logically applying logic to solve that. And it frequently requires you to go through several steps before you can actually select the correct answer. So to kind of help solidify these cognitive levels a little bit, we have some sample questions. These all come from exams that have been retired, so they were real questions, however, they are no longer on the current exams. So an example of a recall question: serum that is positive for HBe antigen indicates what? The answer is A, an increased likelihood of infectivity. And as you can see, this question just requires that you know what this test indicates. The next level of question is application. And as you can see, this question's a little bit longer, which many times they are. So you have a 65-year-old patient who presents with jaundice and elevated liver enzymes. Blood is drawn for viral hepatitis screen with the following results. And it tells you your results for hepatitis A, hepatitis B, and hepatitis C. And the question is, which of the following is the most likely cause of the symptoms? And the answer is A. And there's a couple things I'd like to point out to you on this question. One is that you kind of have to pull a couple different results together to get to the answer. And in the question itself, you'll notice that the word most is capitalized. That's so that you can really focus in that that's what the question's asking. So make sure you pay attention to those clues when you're taking the test. The next question is an example of analysis. So you have a previously healthy 70-year-old who presents with a productive cough. Which of the following diagnostic test results would be consistent with a diagnosis of community-acquired pneumonia? And as you read through the different possibilities for answers, you can see that you really have to think about, okay, community-acquired pneumonia, what exactly does that mean? You have to think about the age of the patient. You have to think about what are the benefits and drawbacks of each method of test to come to the conclusion that the answer is C. So as you can see, it takes a little bit more thought and a little bit more putting pieces together to answer the analysis question. So you definitely want to take your time with those questions. All right, now that you have an idea of what to expect on the actual test, let's go over some strategies that can help you be at your best when you show up for that test. Obviously, you want to get a good night's sleep, not just the night before, but for several days prior to the test, so that tiredness is not decreasing your concentration. You want to eat a balanced meal before taking the test. And most importantly, think positively. You've studied, you're prepared for this, you'll do well. You want to expect and even accept a bit of stress. This is a very different situation from your normal everyday activities. You'll be in a different place. You probably have lots of expectations on yourself to do well on the test. You will be a little bit stressed. Just expect that and accept it. Definitely want to show up on time. Utilize the sample test to familiarize yourself with the testing software. Before the test starts, they allow you to just kind of play with the software so that you know, okay, here's how I answer a question, here's how I go to the next question. Make sure you utilize that and are completely familiar with the software before you begin the actual test. The most important piece of information I can give you is to read each question carefully. As you saw from the one example where most was capitalized, sometimes it might be which is the least likely. So you definitely want to make sure you read the question correctly. I would hate for anybody to miss a question that knew it because they didn't slow down and read. And lastly, pace yourself. You will have 3 hours once the test begins, and a clock will show on the screen so that you know how much time you have left. So just pace yourself and take the necessary time. Some tips for once you're there and actually ready to take the test. Stay focused. There will be other people in the room, so make sure you stay focused on what you're doing. An easy way to do this might be to go through and answer the questions that you know first. Absolutely answer every question. There's no added penalty for answering a question wrong. So you want to make sure that you answer every question. Use all of the allotted time if you need it. And lastly, picture yourself walking out of the test center having done your very best because you've put all those great tips into place that Joann told us about on how to study. Next, I want to spend a little bit of time about what to expect at the test center. For many of us, this was the first time we had to take a computerized exam, so we weren't real sure what to expect. The most important thing you can do is arrive at your scheduled time. If you arrive more than 15 minutes after the scheduled exam start, you won't be allowed to sit for the exam. Don't bring anyone with you. No guests, visitors, or family members are allowed in the testing room or in the reception area. Make sure you bring acceptable identification. You will be required to prove documentation that you are who you say you are. Primary form of identification must be a currently valid government-issued photo ID. And you must also have a secondary form of identification. Only silent, non-programmable calculators without alpha keys or printing capabilities are allowed in the testing room. So now you know, show up on time and what you can and can't bring. The only thing you really need to bring for the test is yourself and your ID. Any other personal items that are brought into the center will be locked into a soft locker, basically a backpack, and will not be accessible during the test. This backpack is approximately 18 by 14 inches, so you don't want to bring in, a huge purse or anything that won't fit in there, because if they can't put it in that locker, you won't be able to take the test. Once you've placed everything into the backpack, you'll be asked to pull any pockets out to ensure that they are empty. You'll be given one sheet of paper at a time to use for scratch paper and a pencil, and then when that's full and you need another one, you hand that in to the test proctor and they will give you another one. CIC takes test security procedures very seriously. Many of these protocols are put into place to protect the security of the test and the security of your certification. You will not be permitted to talk to any other test takers during the exam. When you show up and show your ID, the testing company will take a picture of you and it will be on the screen during the testing process. All candidates are monitored throughout the exam process, both by proctors that walk through the center and by camera that is monitored off-site. If any personal items are observed in the testing room after the exam is started, the exam will be forfeited. So it's very important to follow all the instructions of the test center personnel. Some miscellaneous procedures, just so that, again, you're more comfortable with what's going on. Eating, drinking, and smoking are not permitted in the testing center. You may take a break whenever you wish. However, the clock does not stop for your 3 hours. The time starts once you begin the actual examination. So spend as much time as you need to familiarize yourself with the computer program, and then once you actually click on to the test, the 3-hour timing begins. One thing to remember is that not everyone in that assessment center is taking the same exam that you are. So the person next to you might be taking a totally different exam that maybe only has a 2-hour time limit. So if they get up and walk out an hour into it, don't panic. Odds are they're taking a totally different exam, and you just need to focus on what you're doing and allow yourself ample time to finish it. If you go over 3 hours, the exam will terminate. Some things about the computer testing. When the exam is completed, the number of examination questions is reported. You want to make sure that you've answered all the questions. Now is your opportunity to go back. If it says only 145 questions have been answered, now's the time to go back and answer those last 5 as long as you still have time left. We'd love to hear your comments about the exam. During the exam, you can make a comment on any question by clicking the exclamation point to the left of the time button. This opens a dialog box where comments may be entered. However, please keep in mind that there is no extra time allotted for entering these comments. Know that these comments are thoroughly reviewed and read, and that we value your feedback. All right, hopefully we've given you lots of tips on how to prepare and take the test, and now Barbara will close out our webinar.
Thank you, Joe. Well, once you finish the test, in most cases, you should get the results immediately. At this time, scores from international sites, such as Canada, will be mailed within 3 to 5 business days. And that is something we're working on to try to see if we can improve that. But in other areas, as I mentioned, you will get them immediately before you leave the center. If you pass, celebrate. Go out and buy yourself those pair of shoes you didn't buy. Go get your favorite drink. Do something with your family, but go out and celebrate. And if you don't pass, don't be discouraged. Consider it as an opportunity you had to get even better idea of what to expect on the test and plan to try again. Focus on studying in the areas where you got your lowest scores. The scores will come back. Previously, Joe told you how many questions there were in each domain. So it'll come back. Say for one of it was 18 questions were in that domain. If it says you got 9 out of 18, that might be an area you need to study more versus it says 16 out of 18. So look at those scores very carefully to help you decide what you should study about for the next go-around. And remember, you know, I love quotes, and this is one of my favorite ones, especially as it comes to something like the certification test. You may never know what results come of your action, but if you do nothing, there will be no result. So if you don't take it, you don't know whether you'll pass or fail. So very, very important to keep that in mind. As we start to wind down, we hope you have found the information presented helpful and you are able to develop your plan. But there's one last question I wanted to go over with you that we get quite frequently, and I bet you somebody watching this is saying, I wish we could ask questions because this is one that I would ask. They want to know why they can't get the correct answers to the test. Well, the major reason is, if we did, we would be out of compliance with the NCCA. In other words, the certification test is certified by a national certification organization. And this is the agency, NCCA, that does that, as well as most other certification bodies. It's not just CIPIC, but if you were a med-surg nurse or a critical care nurse, it would be the same sort of thing. We are surveyed every 5 years to get re-credentialed by NCCA, and at one point almost lost our accreditation over providing answers. So that's why we've had to stop doing that. Well, that's it, and we really appreciate your paying attention. I did want to share with you the 2013 CIC Board of Directors. There's 3 of us on the call today on the webinar. But your current president is Greg Gillum from Little Rock, Arkansas. President-elect is Dr. Sue from Canada. The Secretary, Kathy McGee from Canada. The Treasurer, Gail Harris from Las Vegas. Myself from Florida. Director Celeste Andrews from New York. Ruth Carrico from Kentucky. Bonnie Sue Norick from Georgia. Lillian Burns from New York. Constance Cutler from Pennsylvania. Christine Zergas from Missouri. Joann Andrews from Florida, and Lita Henman from Ohio. We also have a consumer director, Steve Langan. Our CICA liaison this year is Bruce Damage, the president of CICA. And our APIC liaison is board member Connie Steed of APIC, and our executive director, Ann Krolakowski. I wanted to share this with you because a couple of things. I wanted to show you how diverse our board is and how the U.S. and Canada are well represented, and hope in the future, after you've passed your test a couple of times, that you would consider putting your name in to be a CIPIC Board of Director. Here's the emails for the 3 presenters today, myself, Barbara R. at BaptistHealth.net, Joann.Andrews at LeeMemorial.org, Henman2 at OhioHealth.com. So as we mentioned earlier, there's not an opportunity to ask questions, but you can do a couple things. Number one, you could send them to one of us, or you could send them, as I said before, to info@cipic.org, and we will get back to you. And here's what I also just said about the address info@cipic.org. But please indicate that it's a webinar in the subject line, so that will help sort and make sure that you get a response quickly. Thank you.